Welcome to the Medicaid Renewal webinar. I've lost coverage. Now what? My name is Tammy Allen, and I am the Co-Executive Director for Families Together, the Kansas Parent Training and Information Center, and Family to Family Health Information Center. We serve families who have a child or youth with disabilities or special health care needs. Many families of medically complex children are impacted by the Medicaid unwinding. Family Voices was awarded funding from the Lucille Packard Foundation and Maternal Child Health Bureau to help families understand and address issues related to the unwinding of the public health emergency. This YouTube will help families who have received a denial through the renewal process to understand what the next steps might be. Once CanCare mails your Medicaid renewal review form, you need to submit your review form back to CanCare within your review period. If you do not submit your review form within your review period, CanCare will contact your managed care organization to inform them you did not return your review form. Remember, you have 30 days to submit your review form back to CanCare. Your MCO will likely attempt to contact you if you fail to return your review form to CanCare on time. You may automatically lose coverage at this time or become disenrolled. However, you have 90 days after you have been disenrolled to return your completed review form back to CanCare. If you return the completed review form during the 90-day window and are still eligible for Medicaid coverage, your enrollment could be backdated so you have continuous coverage. It is important to call your Medicaid provider to ask for more information and to work directly with them. The managed care organizations in Kansas is Aetna, Sunflower, and United Healthcare. If you missed the 90-day window or were deemed ineligible for Medicaid coverage, don't stress. You do have three primary ways that a family will find out that their child has been denied Medicaid. The first is that you will receive a letter of denial or disenrollment in the mail. These letters look differently state by state, but the letter will use words like denial, disenrollment, or cancellation. The second way you might learn that your child has lost Medicaid coverage is that you will go to use your child's Medicaid card and it will be denied or will show a message that the card is no longer active. The third way that you will find out about this change is when you log into your Kansas portal, MCO portal, or any other official system to check your child's eligibility status. Once communication has been made by whichever means, you must decide if you think that the denial or termination is correct, or if you need to pursue one of three options to try and keep your Medicaid coverage. We'll take a look at those options right now. Less than 90 days have passed since you were denied. A family can request that their Medicaid be reinstated. This option is used most often when you have moved and have not updated Medicaid with your new address, or if you did not realize the importance of returning the paperwork if you did receive it. In this case, you must return the redetermination paperwork that you were sent, even though it is past the original deadline. The requirement is that you submit this paperwork within the 90-day window following the date of the denial or termination of coverage. If the time to request a reinstatement has passed, then you can file an appeal. Everyone has the right to appeal a Medicaid decision regardless of where you live. The deadline to file the appeal in Kansas with the managed care organization is 63 calendar days from the date of notice of denial is mailed, and it must come from the individual impacted or from a designated and authorized representative. Kansas notice of appeal can be done orally or in writing to your. Regardless of the method used, it is important to document the date of filing. If the appeal is filed online or via a mobile device, you should receive either an email or be directed to a screen that provides a timestamp. Print this information or take a screenshot so that you will have this to refer to. If you can't do that, at least make a note of time and date so that you know exactly when it was submitted. In case you are asked, if you submit your appeal by mail, ask the post office for a receipt of mailing. If you submit the appeal in person at an office, request that they provide you with a receipt showing the date and time. A question that we hear a lot is, what if I miss my deadline to appeal? In these cases, if there is a good cause why you did not appeal during the required time, you can request an extension. If, however, you truly missed the deadline and are not granted an extension, you can reapply for Medicaid coverage at any time. An example of a good cause exception might be insufficiency of the notice or unable to reach the eligibility worker. This is based on whether mitigating circumstances exist for why you did not file during the 90-day period. Once an appeal has been filed, the Medicaid office will likely try to resolve the appeal informally. Typically in these cases, the office will request more information about finances and potentially about the children's medical conditions if they believe that a waiver or other special program may be available. They may also schedule an interview during which they will ask questions to determine if there is something that they missed in the initial redetermination finding. This is the time to introduce any new information you may have about your child. If, at the end of this process, you are not satisfied with the outcome of the appeal, you do have the right to request a hearing. Anyone can request that their benefits continue during the appeals process. This request must be received by the agency before the date that the agency proposes to end benefits or coverage and should accompany the original appeal. In most situations, the agency is required to give 10-day notice from the date that notice is sent to the date benefits or coverage end. If it is proven that this 10-day period was not provided, the agency may be required to reinstate benefits. If you do not go on to win this appeal, you may be required to pay back the benefits that were received during this time. This is required only for non-HCBS services. Once your options for reinstatement or appeal have been exhausted, if you still believe that you should qualify, or if you believe that your child may qualify on their own, you can reapply for Medicaid coverage. It's always a good idea in this case to reach out to local agencies that might be able to help you identify special application procedures and any alternative paths to Medicaid that might be available for children, especially children with special health care needs. Alternative ways for children to access Medicaid vary widely by state. One example in Kansas is the CHIP program, the Children's Health Insurance Program. The income limits for CHIP are higher than traditional Medicaid, but CHIP does typically require families to pay a small premium, which is based on a sliding scale relative to their income. As a person with a disability is transitioning to adulthood, there are long-term care services available. Another option is a home and community-based services waiver. These are typically available to children with complex disabilities and intellectual developmental delays, regardless of their family's income. But in Kansas, there is a long wait list for this waiver. Even if the waiting list is long, it is important that you are aware of these options and apply to get on the wait list. Work with your managed care organization to make sure that you are aware of all the options of alternative forms for Medicaid so that you can identify the program that is best for you. If neither of these options are available, you can pursue employer-sponsored coverage or visit the Affordable Care Act marketplace to explore policy options. In many cases, There are subsidies available with these policies that can make them very affordable. Dental and vision coverage is typically also available through the marketplace. If you think you have been discontinued in error or have information that you think would make your child eligible after you turned in your renewal, you can contact the CanCare Clearinghouse, 1-800-792-4884. If you feel you still need help after you've contacted the Clearinghouse, you can contact the CanCare Ombudsman's Office at 855-643-8101. Families Together has two parent center offices in Kansas. One is located in Topeka and one in Wichita. We also have remote staff across the state. Each parent center is staffed by parents, siblings, or family members of persons with disabilities who can assist each person who calls with practical and well-informed support. We are parents serving parents. This is one of the most unique things about our organization. The staff have walked in similar shoes of those who contact us, which has proven to put families at ease and to be very effective. If you have questions about Medicaid renewals, feel free to call any of our family health resource specialists at any time.